So next question is 58. When using non-verbal communication in a nurse-client relationship, the nurse must be most aware of option A, ethnic background, client's development level, contradictions to the clients, then nervous hand movements. So non-verbal communication में क्या है, तुम्हें मतलब जो पेशेंट का जेस्चर में तुम्हें समझना होगा, राइट? दैट इज समथिंग कॉल्ड नॉन वर्बल. लाइक पेशेंट इज नॉट टेलिंग, यू हैव टू अंडरस्टैंड व्हाट पेशेंट्स आर डूइंग, राइट? सो दैट विल बी ऑप्शन डी. सी ऑल अदर्स आर सम अदर factors, but if patient is nervously, if patient is nervous and he is moving his hand like rapidly, then you can understand that there is a non-verbal communication that patient showing, right? Now, while using non-verbal communication, it is important to understand cultural difference because some non-verbal gestures may be offensive to people from a different culture or ethnic background. Clear? In communicating with patients, the word rapport means, what does it mean, rapport? Okay, to discuss problems and treatment with a patient, to report the patient's feeling to a doctor, to understand the patient's, then next, to show genuine feeling of goodwill. So that is option D. We are showing genuineness, right? That we want good to the patient. So that is basically called rapport. See, rapport is relationship of mutual trust and understanding between the patient and physician, nurse or other healthcare provider. In other words, rapport means harmonious relationship of in which peoples understands each other's feelings or ideas and communicate well. Clear? मतलब क्या बोल रहे हैं, rapport में हार्मोनियस रिलेशनशिप उस जिसमें मतलब पीपल अंडरस्टैंड देयर मतलब अदर फीलिंग्स एंड एज वेल एज खुद का आइडियाज एंड कम्युनिकेशन बिल्ड कर सकते हैं, वही है रैपोर्ट. क्लियर? नाउ नेक्स्ट इज 60. फर्स्ट फेज ऑफ थेराप्यूटिक नर्स पेशेंट रिलेशनशिप इज ऑप्शन ए ओरिएंटेशन, प्री इंटरेक्शन, वर्किंग एंड टर्मिनेशन. दैट विल बी प्री वर्किंग, like pre-interaction phase, right? That is pre-interaction phase. Phases of therapeutic nurse-client relationship includes pre-interaction phase of self-exploration of nurse. It begins before the nurse first contacts with the client. The nurse get information from significant other, then chart health team member and patient history. It's time for nurse to explore own feeling and fears related to upcoming patient. मतलब क्या है, साइकेट्री में क्या है ना, पेशेंट के बारे में लोग ज्यादा कुछ सोच लेते हैं कि वो अगर वायलेंट हुआ तो क्या होगा, अगर वो पेशेंट कुछ नहीं शेयर कर रहे तो हम कैसे हिस्ट्री लेंगे. जैसे मेरा मान लो अगर पेशेंट का एक तो तुम्हें मतलब he or she is not interacting with the healthcare professional, right? You have to build trust, rapport, then only they will open up. Clear? So in pre-interaction phase ना, like we generally मतलब जब तुम भी फर्स्ट टाइम जाओगे ना, तुम्हारे अंदर भी एक आएगा कि कैसा पेशेंट मिलेगा तुम्हें, क्या वो मतलब कम्युनिकेट करेगा या कोऑपरेट करेगा, तो ये सब सोच आ जाता है. तो दैट इज द समथिंग यू हैव टू वर्क विथ, बिकॉज दैट टाइम यू हैव टू ओवरकम योर फियर, लाइक ऑल अदर past whatever you heard from other, that also you have to avoid, right? Because you have to think as per situation, whatever is coming, then you have to deal with that. So that is pre-interaction phase, right? In orientation phase, what you are doing during this phase, both become acquainted to each other. Now patient has been arrived to hospital, right? मतलब वो तुम्हारे वार्ड में आ गए हैं, तो इसमें क्या होगा, ट्रस्ट एंड मतलब एस्टेब्लिश रैपोर्ट, मतलब इसमें तुम ट्रस्ट एंड रैपोर्ट एस्टेब्लिश करने के काम में लग जाओगे, राइट? एंड यू विल गैदर पेशेंट्स इंफॉर्मेशन लाइक पेशेंट्स फीलिंग्स, स्ट्रेंथ, वीकनेस, सेट क्लाइंट सेंटर्ड गोल प्रायोरिटी दैट आर म्यूचुअली एग्रीएबल। मतलब अब तुम अगर ट्रस्ट एंड रेपो बिल्ड कर लिया तो अब तुम पेशेंट को कुछ बोलोगे कि तुम्हें ये करना है, तुम्हें ये नहीं करना है, किसी में अगर वीकनेस है वो तुम्हें उसके ऊपर तुम काम करो, राइट। सो ये सब फेज आएगा ओरिएंटेशन में। नाउ वर्किंग पे क्या है, थेराप्यूटिक वर्क डन नाउ, देन ब्रिंगिंग एक्चुअल बिहेवियर चेंज, प्रॉब्लम एनकाउंटर ड्यूरिंग this phase are testing of nurse by the patient. Then nurses fears of closeness, resistance behavior by patient and transference and counter transference happens. मतलब working phase में क्या है, transference, counter transference, let me clear you that one first. Transference means मतलब मान लो patient is thinking nurse as his or her फैमिली मेंबर। मतलब फॉर एग्जाम्पल कि नर्स आए हैं तो पेशेंट उसको अपनी दीदी जैसे समझ रही है, राइट। लाइक मान लो उसका कुछ हैपन हुआ, उसकी दीदी थी, वो शादी के बाद चली गई, फिर उसके बाद से वो डिप्रेस हो गई, राइट। अब नर्स अगर आए हैं उसको केयर कर रहे हैं तो उसके अंदर ना वो अपने दीदी को ढूंढ रही है, तो ये हुआ तुम्हारा ट्रांसफरेंस। लाइक इट इज अ कैजुअल एग्जाम्पल, राइट। एंड काउंटर ट्रांसफरेंस मीन्स ऑपोजिट, मान लो कि नर्स पेशेंट को अपने भाई जैसा समझ रहे, क्लियर। सो दिस शुड नॉट बी हैपन बिकॉज वी आर ऑल working in hospital in a professional manner, right? So we have to maintain that professionalism. So that's why in working phase we have to see during this phase a testing of nurse by patient, nurse's fear of closeness, resistance behavior by patient and transference and counter transference. Sometimes ये मैं अच्छा वाला बोली हूँ, ठीक है। कभी कभी मान लो बहुत गुस्सा वाला पार्ट भी आ सकता है कि पेशेंट नर्स को अपने मतलब मान लो कोई दुश्मन जैसे समझ रहे, राइट। मतलब दूसरे के कैरेक्टर और नर्स के या हेल्थ केयर कुछ भी, मतलब फिजिशियन भी हो सकते हैं, उसके अंदर देख रहे हैं, तो ये है हमारा ट्रांसफरेंस। एंड काउंटर ट्रांसफरेंस में अगर हेल्थ केयर वर्कर इज थिंकिंग अ पेशेंट लाइक अ बिल्डिंग अ रिलेशनशिप या क्लोजनेस टू with the patient, so that will be counter transference. Clear? Now termination or separation phase. What is that? Evaluate progress and achievement. Goal of this phase is to bring a therapeutic end of relationship. Now here patient is preparing for discharge, and here the termination or separation will be happen, right? Like evaluate progress and achievement. Goal of this phase is to bring a therapeutic end of relationship. Clear? Now next question, that is 61. During the initial phase of nurse-client relationship, which of the following should occur? Encouraging verbalization of feelings, establishing therapeutic contract, exploring alternate behavior, evaluating plan of action. मतलब क्या बोल रहे हैं, इनिशियल फेज में कौन सा वाला मतलब होना चाहिए, व्हिच ऑफ द फॉलोइंग शुड ऑकर, राइट। मतलब क्या करें, एनकरेजिंग द वर्बलाइजेशन ऑफ फीलिंग्स, एस्टैब्लिशिंग थेराप्यूटिक कॉन्ट्रैक्ट, एक्सप्लोरिंग अल्टरनेट बिहेवियर एंड इवेल्युएटिंग प्लान ऑफ एक्शन। सो दैट विल बी ऑप्शन सी। क्लियर? Exploring alternate behavior. Exploring alternate behaviors of nurse, self according incoming patient's history and need may occur into pre-interaction phase. Clear? Now establishing therapeutic contract between patient and nurse and encouraging to verbalize feelings and thought occur into orientation phase. Now during the orientation phase of the helping relationship, nurse might do which following: discuss the cards and flowers in the room, review client's history to identify possible health concern, then work together with client to establish goals, use therapeutic communication to manage the client's confusion. So इसमें क्या बोल रहे हैं, ओरिएंटेशन फेज में हम क्या कर रहे हैं, face the helping relationship, nurse might do which of the following. So that will be work together with the client to establish goal, right? ओरिएंटेशन में मतलब क्या है, पेशेंट आ गया, अभी अभी हम डिस्कस किया ना वो वाला चीज, राइट। सो यू हैव टू रिलेट एंड स्टडी एंड देन यू हैव टू आंसर, Now, most of the goals of nurse-patient relationship can be achieved during orientation phase, trusting phase, termination phase, and working phase. So that will be working phase. Now all we have studied. Most of the therapeutic work is carried out during the working phase of nurse-patient therapeutic relationship. Actual behavioral change is the focus of attention in this phase of relationship. 64. During the working phase of nurse-patient relationship, the mentally ill client breaks appointment, comes late to the therapy, and being forgetful. The nurse identifies that this behavior is an example of option A, resistance, counter-transference, transference, and boundary violation. What is that? Any guess? So that will be resistance. Let's see why it is the correct answer. Resistance behaviors are expressed through suppression and repression of relevant information, intensification of symptoms, breaking appointment, coming late to the session, being forgetfulness and silent, and sleeping in session. So this is basically a resistance. Okay. जो रियल एग्जामिनेशन में अगर तुम सोच लो डिप्रेस्ड या वायलेट पेशेंट है, स्पेशली फॉर दोस पेशेंट आर बॉर्डर लाइन personality disorder, right? So they generally don't want to be socialized, right? In that case, now if you like sometimes after a certain period of time, now you are trying to make them socialize. That time you have told the patient that you have to come at 9 AM and you have to attend the things, and you will tell about the everything that will be discussed in the meeting, and it is just an interaction like that you have already told everything, but the patient is showing like he has forgot and he didn't come at all and he is sleeping at that time, or if we have present in the meeting but still there he is trying to sleep. So this is a resistance behavior. Hope it is clear. 65. A phenomenon during therapeutic nurse-client relationship when client unconsciously attributes or transfers to the nurse feelings and behavioral predispositions formed towards the patient from his or her past. So that is transference. मतलब क्या है इसमें? Patient is showing, right? That is called transference. Okay. So option C will be the correct answer. Resistance, transference, and counter-transference and boundary violation are therapeutic impasses block in nurse and patient relationship. We know, right? Now transference means client's unconscious transfer or displacement of feeling, anger, hostility toward nurse which originally associated with another individual by patient's past life experience. It is a problem encountered by nurse during working phase by showing uncooperativeness and resistance by patient to the therapy. Counter-transference, reverse transference, which expressed by nurse toward patient. As I have already told with the example, here mainly they have like thrown the tantrums to the healthcare worker, anger and hostility. Can you see? Yeah. Now, in working with the patient, when the best time to prepare the patient for the termination phase, and it will be start with orientation phase itself. Like when patient is coming, from that time itself we will be working for the termination. Clear? See, preparation of the termination phase begins at the orientation phase, when the duration and length of the nurse-client relationship was established. जब वो relationship या therapeutic relationship is going to start, at that time only we are planning for termination phase. Like we know, right, that if patient is coming to hospital, anyway they will be discharged. So that is the thing basically we know in hospital setup. Now the most difficult and critical phase of nurse-patient relationship is orientation, working, and termination and induction phase. That is termination, right? because that time na patient sometimes get dependent to the nurse or healthcare worker. See, termination phase is most difficult and critical because both the nurse and client may experience feeling of sadness and loss of goal of this phase is to bring the therapeutic end of relationship. From the patient side, from the nurse side, it is kind of sad, right? So that is the most difficult and critical phase. Now 68, when a nurse-patient relationship is ending, the patient may react by rejecting the nurse, becoming angry, regression and withdrawal and acceptance. What will be the one? That is becoming angry, right? Like when मान लो patient का termination phase आ गया है, मतलब अभी patient is about to discharge. That time also they will show angerness, because they will show like they can do by themselves and they're trying to avoid, right? See, when the therapeutic nurse patient relationship ending in the termination or separation phase, the patient may react by becoming angry, distancing from the relationship and by returns of symptoms and dependency. As I have told, that patient like become dependent to the nurse, right? Like medication, like therapy, like everything they were talking, they were like communicating. So that time when it is time to discharge, that time the patient may show like distancing from the therapy, like patient may not cooperate sometimes and they will show angerness, like that they may show, right? Now 69, self understanding is facilitated by study of Newman's window, Kothari window, Johari window and Bohari window. So that will be Johari window, right? Self understanding we have already studied, right? That is Johari window. Now next one, see, what is Johari window? It was created by two American psychologists, Joseph Luft and Harry Ingham, in 1955. Okay, it is a visual framework and used to understand more about yourself, conscious and unconscious biases to improve self and or understanding, right? It is divided into 4 quadrants, we know, right? Open area, blind area, hidden area and unknown area. Open area means what you know and also other also know about you, right? Blind area means you don't know but others know about you. Hidden area means you also don't know and others also don't know. Sorry, that will be unknown area. Hidden area means you are knowing that but you are like others, people are not knowing, right? So let's see. I am giving you one example. Open area means you are a good student, you are studious, you are doing hard work before exam. Like you also know, like that you are hardworking, and sometimes also you may not be knowing. So that is another thing. But suppose you know and others also know. So that is your open area. Blind area means, what does that mean? Means मान लो you don't know, right? So during exam na, you stop talking to others, like you don't communicate properly, you avoid people, like you don't like crowds and all. So you don't know these things, that you in your subconscious mind you are doing that, but others are following, others are like noticing you. So that is coming under blind area. So how you can enhance your blind area? By taking feedback. Okay, your close people, your close friends can tell you like why you are avoiding me during exam and all. Then you can think, acha, yeah, maybe I am not communicating with them, like that. Okay, so that is coming under blind area. Now hidden area, what is that? Okay, मान लो now you are a good driver, या scooty या bike driver, right? So what happened? But you had an accident. Okay, so because when you are driving, मतलब जो डबल पैसेंजर होता है, जो पीछे तुम्हारा भाई था या बहन था, उसको लेके तुम गिर गए थे, राइट, मेन रोड में. तो उसके बाद से ना क्या करोगे, तुम अकेले ही ड्राइव करते हो, तुम किसी को नहीं लेते हो पीछे, राइट. सो दैट फियर still present in your mind, so that you know that why it is scary for you. But others don't know. They may think you are aggressive, you don't take them lift, you don't help them, like that they can think. So that is coming under hidden area. You have to work with that fear may not be should not drive you, right? You have to overcome that. So that is coming under hidden area. Unknown area means you also don't know, others also don't know. So suppose you are good at sketching or painting, right? You don't know, and others also don't know, but if you give a try, you can do better. So that is under unknown area. So you can work, you can explore what all you can do. So that is coming under unknown area. So I am giving a basic like day-to-day life example, so that you can understand. You can give, you can write in exam as well. So hope it helps. Clear? Next is 70. When used in the context of nursing, which quadrant of the Johari window has non-productive space for individuals who hinders communication with each other? That is blind area. Okay. Now coming to number 71. Nurses can help patients in an unknown area of Johari window by creating an environment that encourages option A, self-discovery, option B, self-esteem, self-concept, self-confidence. So that will be self-discovery, right? So here option A will be the correct answer. Now coming to next question. All following are therapeutic communication techniques except advising, observing, listening and silence. So we should not advise anything to the patient, right? That is a barrier, or that will not build a trust, because if patient is telling you something and you are giving instant advice, then that patient may not accept you, and basically they won't accept you. So this is not a therapeutic communication technique. So option A will be the correct answer. Here you have to mark that except. All other points are the components of therapeutic communication. Now, therapeutic communication techniques, a way of communication between nurse and client that make the communication therapeutic. Either restating, focusing, open-ended question, paraphrasing, listening, validating, silence, then advising, broad opening, clarification, reflection, informing, sharing perception, theme identification, summarizing and making observation. Okay. Next question, that is communication technique in which repeating the main idea of what the patient just said. It is called accepting, reflecting, restating और broad opening. मतलब क्या बोल रहा है, पेशेंट जो तुम्हें बोले हैं वो फिर से तुम रिपीट कर रहे हो. कि मान लो पेशेंट इज टेलिंग दैट आई एम सैड बिकॉज आई हैड फाइट with my dad last night. Okay, so you will repeat that phrase again, that you are sad, you are upset because that fight has made you upset. Like that you will same thing you will just repeat after patient what they have just told you. Okay, that is called restating. See, repeating the main idea or thought expressed or said by patient or client called restating. Clear? Now next is, a female patient is admitted in acute psychiatric ward after a suicidal attempt. She says to you, why am I still alive? There are no valid reason for me to live in this world. Okay? Whatever happened in my life was a failure only. I am good for nothing. What would be your response that promotes therapeutic communication with this patient? Okay, matlab we have already studied na that what all are the clinical symptoms of a patient who is having depression. Okay, so all these things like helplessness, hopelessness and worthlessness, all these three symptoms will be present to the patient. Now we have seen the scenario. Now we have to tell that what the nurse should tell to promote the therapeutic communication. That is, you have many reasons to lie for. Why are you thinking in a negative way? You are depressed now, that's why you are talking so. Now next is, you have been feeling like a failure for a while. मतलब बाकी देखो सामने जो तीन है ना, वो अगर तुम बोलोगे तो तुम्हारा डिस्कशन वहीं पे ही एंड हो जाएगा, है ना. बट इफ यू टेल दैट यू हैव बीन फीलिंग लाइक अ फेलियर फॉर ए वाइल, मतलब क्या है, यू आर आस्किंग दैट यू आर फीलिंग like a failure or for a while, then patient may open up that why she is feeling like that. She can tell to the nurse. Hope it is clear. So here option D will be the correct answer. You have been feeling like a failure for a while. Hope it is clear. It is an example of restating repetition of client's main idea, which gives chance to client to express feelings continuously. ओके, नाउ ओनली वी हैव स्टडीड ना. रिस्टेटिंग मीन्स पेशेंट जो बोले हैं वही तुम रिपीट कर रहे हो, वही तुम पूछ रहे हो कि जो आप बोले हो अभी, क्या आप उसका मीनिंग ये बोल रहे हो, है ना. मतलब यू आर जस्ट कंफर्मिंग. रिस्टेटिंग का मतलब क्या है, यू आर कंफर्मिंग बिकॉज समटाइम्स पेशेंट व्हाट दे आर टेलिंग मे बी दे आर नॉट फीलिंग समटाइम्स, सो यू हैव टू कंफर्म दैट बाय रिस्टेटिंग इट अगेन. ओके, next is communication technique used for a client who is confused and talking about many things at a time. That is, use open-ended question, focusing, use of silence, use of touch. So that will be focusing. Okay, because patient is talking like a confused person and many things at a time. Okay, so how you will suppose if you have asked the patient that what happened when you passed out from your college or something like a scenario based मान लो, but patient is telling something like my college was like that there and my friends were from there. मतलब जो मेन चीज में ना उसमें तो वो मतलब कुछ और ही बोल रहे, बहुत सारी चीज एक साथ बोल रहे हैं. सो नाउ यू हैव टू फोकस दैट आप बोलो क्या बोलना चाहते हैं, लाइक ओपन एंडेड क्वेश्चन, एंड वी हैव टू रिफोकस और रिस्टेट द स्टेटमेंट्स टू द पेशेंट. ओके, देन directing the conversation on the topic being discussed called focusing. It used in a client who is moving rapidly from one thought to another. Okay, that we have studied circumstantiality, tangentiality, like that na, flight of ideas. So everything may be present in a client, so like that you have to deal. Okay, now when assessing a patient with appendicitis, how a nurse must initiate to get information. Option A, tell me how you are feeling, tell me where is the pain, tell me relief of pain with what, tell me whether cough aggravates the pain. Okay, मतलब पेशेंट को अपेंडिसाइटिस हुआ है, अभी नर्स अगर इनिशिएट करना चाहता है कोई कम्युनिकेशन या एसेसिंग पार्ट में उसको जानना है ना, तो कैसे करेंगे. तो इफ you ask that how you are feeling, as a nurse you are going to the patient's cabin and simply asking that today how you are feeling. Okay, so that may initiate a conversation and you can assess. Okay, so say tell me how you are feeling is a broad opening or open-ended question. Okay, if you ask a close-ended question means क्या है, close-ended patient will answer only yes और नो. मतलब अगर क्वेश्चन फॉर्म ऐसा होता कि आज क्या आपका दर्द हो रहा है, तो पेशेंट विल आंसर यू बाय येस और नो. okay, but that is not a matlab kind of assessing part, because you have to assess the quality of pain, timing of pain, then if it is moving, okay, so everything you have to assess, right? So like that you have to ask open-ended question to the patient. So because it will encourage client to start discussion about the topic, which is a therapeutic technique of communication. Hope it is clear. Now 77. Choose the most therapeutic response to Mr. Shyam's question, am I going to die? Okay. So patient, मान लो तुम केबिन में गए जो रूटीन केयर देने. Now suddenly patient is telling you that am I going to die? Okay. Now what you will tell? We all are going to die one day. No. What has your doctor told you? No. You really don't want to talk about death, do you? No. Then would you like to talk about your condition and prognosis? Okay. Maybe this may open up the patient. Okay. That what you are thinking about your condition and your disease prognosis, right? What you are thinking about that. Okay. Then we can understand. So here option D will be the correct answer. Now 78. What is the most appropriate nurse response to a myocardial infarction client who is fearful of dying? Option A, tell me about your feeling right now. When doctor arrive, everything will be fine. No, this is a bad situation, but you will feel better soon. This is also not kind of therapeutic thing. Please be assured we are doing everything we can to make you feel better. Yeah, this is somewhat right, but we are not supposed to tell. We are not, मतलब हम नहीं बोल सकते ऐसे पेशेंट को. Okay, so we'll ask that आप क्या फील कर रहे हैं वो हमें बताइए. ठीक है. See option A, tell me about your feeling right now. Okay. Option E is an open-ended question which encourages the patient to express feelings. Clear? 79. A client with paranoid schizophrenia has a delusion of persecution. He tells the nurse the CIA is out to get me. They are spying on me. The nurse's best initial response is, okay. Option A, how would they spy on you here? I don't want to hurt you. Tell me how they are trying to get you. I know the CIA would not want to hurt you. So what will be the correct answer? मतलब पैरानॉइड स्किज़ोफ्रेनिया में क्या है ना, डिल्यूशन और परसिक्यूशन मतलब सस्पिशियस हो जाना, राइट? सो विल आस्क टेल मी हाउ दे आर ट्राइंग टू गेट यू. मतलब हम पूछेंगे कि कुछ मतलब पेशेंट को कुछ हेलुसिनेशन हो रहा है, मतलब उसका कुछ ऑडिबल मतलब या विजुअल या कुछ हो रहा है ना, तभी वो बोल रहे हैं. पैरानॉइड स्किज़ोफ्रेनिया में क्या है, पेशेंट इज सस्पिशियस, मतलब सुपर सस्पिशियस. अगर तुम उसके सामने भी कुछ बोल रहे हो ना किसी और को, मतलब अपने स्टाफ को ही कुछ बोल रहे हो, तो वो सोचेगा कि तुम उसके बारे में बात करो. सो फॉर दिस काइंड ऑफ पेशेंट ना, यू शुड talk nicely and without reducing your like volume, okay, because patient will get extra suspicious in everything around her or his. Okay, so that's why we'll be asking, like we'll further assess like what you are feeling, like why, how they are trying to get you, when it is happening. Okay, like that we will ask. That will be open-ended question. Hope it is clear. When a client says, I can't focus, my mind keeps wandering, then nurse replies saying, you are having difficulty in concentrating. This is example of communication technique, that is focusing, paraphrasing, summarizing and confronting. So paraphrasing, okay, मतलब patient बोल रहे हैं they I can't focus and my mind keeps wandering, मतलब focus नहीं कर पा रही हूँ and माइंड्स भी इधर उधर जा रहे. ठीक है. देन नर्स इज टेलिंग दैट यू आर हैविंग डिफिकल्टी इन कंसंट्रेटिंग. मतलब पैराफ्रेजिंग में क्या है, रिस्टेटिंग में क्या है, पेशेंट जो बोल रहे हैं वही चीज हम रिपीट कर रहे हैं, राइट? इसमें क्या है, नर्स इज टेलिंग इन देयर ओन वर्ड्स से आई कांट फोकस माई माइंड कीप्स वंडरिंग, मतलब वो जितना कुछ बोल रहे हैं उसको हम शॉर्ट करके पैराफ्रेज में बोल रहे हैं, इसको हम बोलते हैं पैराफ्रेजिंग. क्लियर? So, when the counselor restating in different words what the client has just said, can you see the difference? Restating में same thing we are repeating, right? But here we are restating the in different words, मतलब अलग words से patient को बोल रहे हैं, using fewer words but without changing the meaning of what the client has just said. Okay? दैट इज कॉल्ड पैराफ्रेजिंग. मतलब क्या है, हम अगर मान लो जैसे समरी करते हैं ना, समरी में क्या है, शॉर्टर वर्ड्स में हम पूरा टॉपिक को बोल देते हैं, तो पैराफ्रेजिंग काइंड ऑफ सेम थिंग, मतलब वी आर सेइंग द सेम थिंग, सेम मीनिंग व्हाट द पेशेंट हैज टोल्ड इन फ्यूअर वर्ड्स. होप इट इज क्लियर. सो दैट इज द बेसिक डिफरेंस बिटवीन पैराफ्रेज एंड रिस्टेट. ओके, you have to remember that therapeutic communication techniques, because sometimes they may trick you in exam as well. That's why I'm clearing all the synopsis part. Okay.